Hello everyone, this is Dr. Fadi Asim. In our session today, we will discuss with Dr. Sally. She passed her OET exam in December 2020 with high score, her experience and how she prepared for the OET exam. So first of all, congratulations Dr. Sally. How are you?
Fine, thank you so much.
So we'll discuss with you in this video how did you start preparing for your OET exam and how long did it take you?
Okay, that's great. So, how long it take for me to prepare for OET exam? It's around 2 months with daily practice around maybe 2 hours to 3 hours per day.
Okay, that's great. I find this period is enough for preparation, like two
I
hours
think
a
so.
day.
Yeah,
Yeah, especially because you might have like weekends off, so you will not be studying daily. You might have some days off in the middle, right?
right.
Great. So to be specific in our discussion, how did you prepare for the speaking subtest?
Okay. So first, for preparing, I have attended some speaking sessions to make me familiar with criteria for you are marking against. Then after that, I went through the phrases that is sent. So how phrases you will use and this. And I use the material which is recalled for previous test, which is future land files. It contains a lot of cards. So I used to practice at least 2 cards per day. Again, is the mirror. And in between, I have my friend I practice with her, but she's so busy in her work. So daily practice is essential.
Wow, great. That's a good advice. Okay, let me ask you another question. In our speaking sessions in the course, we used to have like speaking practice for explanation and practice, and usually are given feedback on your performance during the cards or during the conversation with the patient. Do you find it's essential after finishing your card to get a feedback from someone who is aware about the exam parts and who is well oriented about the assessment criteria?
Yes, it's most essential that you have a feedback about your um, about your performance, so you will know which is the weak and which is the good, and you will proceed on. I think it's essential to get a feedback from who is expert in giving that feedback.
Okay, that's good. Our last question will be, lots of doctors nowadays are preparing for their OET exam. So what
Yeah.
advice can you give them regarding the speaking subtest while they are preparing?
To make themselves familiar with go stepwise, make themselves familiar with um, criteria, then to memorize some phrases that will help them to save the time, then practice is a cornerstone.
That's a very good tip. Thank you so much. And I believe in our course, we have the notes that have some phrases that might be helpful during the practice. So it gives you an idea and some of the ways how you talk to the patient, especially in special situations, like if the patient is angry, if the patient is having some sort of
Yeah.
malignancy, and if the patient is a pediatric patient. So there are different ways to approach and to deal with these patients. So did you find the notes useful in that?
Yes, the advice, the note is useful, and it makes the road is so easy and comfortable. I agree with you.
Great. Thank you so much for your
You're
time
welcome.
today. And hopefully, we will make more videos in the near future. And for people who would like to would like to follow our videos, they can join the YouTube channel. Thank you.
You're welcome.